basically set up for the manipulation by doing what you guys just did, by doing all the locking and setting up for the joint mobilization with locking above and below. So the two manipulations that I want you guys to learn are both gapping manipulations. They both are meant to be kind of opening. One's for the SI joint, one's for a lumbar facet. And they're both going to take place with some flexion bias, all right? So if I take my patient and I say L4-5, I want to do a gapping manipulation at L4-5. So I'm going to start to take their legs. Remember, we talked about the trick of being like, well, if I'm not sure if I'm on S1 or L5, well, get your fingers around the segment, and as you flex, if the whole area is moving, you're still on the sacrum. So now I can go up one more. All right, there's L5, S1, there's L4, L5. So what you're going to do is you're going to flex up to, but not quite into that segment. So if you feel like, and this takes some practice, but feeling like L4 starts to move, you might want to back up a little bit. But you flex well up to that segment, all right? Straighten out the bottom leg. Same thing as you did for your joint mob. Same exact thing. I'm gonna keep my finger here, grab his arm, we're gonna rotate all the way down to that segment, hand goes back there. Okay, he's rotation locked down to that segment, he's flexed up to that segment. I'm going to, again, log roll him back towards me, and now I'm gonna re-lock all the way down to that segment. He's still flexed up to it, he's rotated all the way down to it. If I just wanted to just sit here and just flexion mobilization away, you could. Sit, that's what you're doing, flexion mobilization, all right? If I want to manipulate, I'm going to take my forearm and I'm going to get on his pelvis. My hand has nothing to do with this anymore. And my force for the manipulation is into side bending with my left hand while I provide counterforce with my right forearm. So you're not rotating him. Do not rotate your patient when you manipulate. You don't manipulate through rotation, you manipulate through side bending, right? We know that there's not much rotation at the facet joints. They don't rotate much. That you can side bend them and open them, and that's what you're trying to do, is gap and side bend and open the facet joints that way. So I take up the slack. That's my pre-manip hold for 10 seconds. Any pain there, Ben? Any problems? I back off the pre-manipulative hold. I'm going to give you a little thrust after a breath out. Is that okay? Mm-hmm. So breath in and breathe out and down towards side bending. So I'm actually taking my body weight and going and to turn a little bit. You turn your body so that you're pulling down with your forearm on their pelvis down. Okay? So I'll lay on the other side and face me. So we cut it there. Just so I'm not doing the same exact way. So that's one of them. All right, and we're going to work on the forearm. Your forearm is the force vector. So your forearm should be facing mostly into side bending. If you're doing a lumbar manipulation and your forearm's like that, we know you're going to be in trouble. It's first of all, it's hard to go into side bending that way. This way you can pull down into side bending. This way you're going to tend to rotate them more if you pull forward. The SI joint technique, however, is more towards rotation because you're not involving a lumbar segment, right? So when we do the SI joint technique, we're going to flex up, but we're not going to involve L5-S1. I'm just bringing his legs up to where the sacrum starts to counternutate. That's about it, staying right there. So he should be down, he shouldn't be up into much hip flexion at all right? Bottom leg straightens out, this leg stays hooked. Now we got to rotate him all the way down through the whole lumbar spine. So he's going to really be rotated quite a bit. And can go back there, which means I'm probably going to have to bring him back quite a bit. And with the SI joint manip, it should look like this. It should look like he's like twisted and the pelvis is almost facing the table. The only other very important part here is you need to get your thumb this thumb on the spinous process of L5 and S1. Because if you don't block that, when you do the rotation, you're going to twist L5, S1. There's no way around it. I mean, you're trying to keep the amplitude low, so maybe there's less of a chance that you're going to do that, but you have to sink your thumb in and stick it on the side of the transverse process to block L5 and S1, because I want the SI joint, right? The manip, pre-manip hold is down towards the floor, you're right? Is down towards the floor, kind of in the line of his femur, not perfectly into rotation, but almost. My counter force is through my elbow and my thumb. You okay with that? Mm-hmm. All right, on the next one, breath in and out, we're gonna nip. Is that all right? Breath in. Down towards the floor in rotation. All right? So those are the two gapping manipulations that you're gonna do. A lot of times, as you set them up and go into the pre-manipulative hold, it pops if it needs to go. A lot of times, it's because you're locking up this big lever, and you can put quite a bit of force into it without having to do the actual thrust. So you guys might get some pops just by setting it up. If that's the case, if that happens during the practical exam, we might just have you do like a mini thrust just to show us that you can control the thrust. But usually with a patient, you're not going to thrust on that. You probably got the manip, you got the mobilization that you're looking for. In some cases, it's very stiff. You don't get much of a pop, but you do get motion come back. All right. So let's break up and